Hi there, nurses, well, nursing students. This is Nurse Ed Scholar here. And once again, we're going to be diving a little bit more into fluid and electrolyte balance. Understand these are very short videos. So I'm just trying my best to just hone in on little bits of information to help you put it all together. So, um, when we're looking into maintaining fluid and electrolyte balance, our bodies, they really try to seek some kind of stability, which we call homeostasis. So stability, homeostasis. And so, we're going to talk a little bit, always a little bit about, how important it is to keep the body fluids at a nearly constant condition. All righty. So when we're looking at, fluid and electrolytes, deficiencies and excess, replacing and eliminating. So, when our bodies start to lack, vital substances, it's we have to replace them. So they can lack them by these same things that it needs to be replaced, except for, the IV solution. But, if our dietary intake is off, or we're not intaking enough fluids or water for hydration, it can throw off our fluid and electrolyte balance. So how do we replace it? We add um, if we increase our dietary intake of vital nutrients, we hydrate ourselves, and then if this can't be done, then we'll have our patients in the hospital, and then they'll be receiving some kind of medical intervention like IV solutions. And so with this, if their potassium is low, you may hear them, depending on the provider, depending on how deficient the potassium is. Let's just talk about that electrolyte. You may hear the term, they may, have some kind of oral supplements, or you may hear, potassium IV. Um, Hydration. If they are hypovolemic, they're going to try to give them IV fluids. If the patient is unable, just say the patient is vomiting, they're not going to be able to take in that hydration. So we may get an order for some, to implement uh, IV solutions for the patient. Um, on the flip side, there is a possibility that the patient may have a fluid volume excess. They may have too much of something. So, they may have too much potassium. So then we'll get orders to uh, initiate particular interventions that we would have to give the patient for them to excrete the potassium, or if there's too much fluid, like now they're hypervolemic, the body's going to have to eliminate that surplus. The body's going to initially try to um, eliminate it itself, but sometimes there may have to be some medical interventions for that. When we go on and we kind of talked about the role of the kidneys. I mean, we are doing fluid and electrolytes, and then there are some hormones that you really have to know. So the kidneys are the main factors of trying to adjust the quantity of water and electrolytes. So I mean, that's what it does. So if there is too little fluid, the body tries to retain. The kidneys try to retain the fluid, or if there's an excess, the kidneys try to excrete it. But there is also aldosterone, and that's from the adrenal glands. And what this does, it kind of helps control the extracellular fluid volume by managing sodium reabsorption. You'll hear a lot wherever salt goes, water goes. So they're going to try to manage the amount of salt will determine the amount of fluid that is reabsorbed. And then there's also that antidiuretic hormone from the pituitary gland, and it tries to keep osmotic pressure in check by regulating water reabsorption by the kidneys. Okay. And so, with that, uh, a lot of the times we don't need, as nurses, we don't really need to, I hate to say this, but we need to know what to assess for. We have to know patho because pathophysiology kind of helps us, it guides us into what we're going to assess, what interventions um, the provider may order. But more or less, when we're looking at, what's the patient condition. We're going to look at labs. We're going to do a physical assessment. And so, we talk about some of these things and we have to know them. But as nurses, our main thing is, what do we assess? What do we teach? What interventions do we look out for? And how to be proactive with all of this, how to anticipate what's about to come. Um, and with that, so that leads into this next slide. What do we as nurses do? When it comes to fluid and electrolytes, and I'm just going to name a few, but we're looking at just say hyponatremia. So hyponatremia could be from a lack of salt intake, or it could be from hypervolemia. Now you have too much solution for the amount of solute. So what happens is that now there's just too much water for the amount of salt. Now the salt content may be, I guess, where it needs to be, but there's just so much volume. So what happens, the person will have hyponatremia. And with that, we're going to have to look for seizures, um, mental status change on our patient. Hypervolemia, with that, we have too much fluid. So we're going to be assessing for, well, one, what's the cause? Is it, ingestion? Have you noticed that the patient's urinary output has decreased? And, so with that, they're retaining fluid. Um, but with that, we're going to be assessing for what? Shortness of breath um, in our patients, or when we auscultate their lungs, maybe they're starting to have those crackles, at the bases. So these are the things that we're looking for, monitoring for, assessing for in our patients. And then with hyper and hypokalemia, these are the labs, main labs, because hyper or hypokalemia will cause cardiovascular um, irregularities. So, we do have to know a lot of things as nurses. And a lot of the things that we know, it just kind of guides us in the direction of how we're going to take care of our patients. And so that's why it's a lot being a nurse. And I'm so excited about all of you partaking on this journey. So that's just a little bit, and it's always going to be a little bit. So just stay tuned. Keep coming back for those little insights and it's going to be more, it's fluid electrolytes now, and then we're going to go into IV therapy, and then we're just going to keep on going on all of the concepts that you will run into in your nursing education journey. So, Nurse Ed Scholar here, understand that knowledge is the greatest tool that you can have in delivering exceptional care. So happy learning, future nurses.